Welcome to Health Talk. Today we're going to talk about glaucoma and the concept of eye self-exam. And with us today we have Sophie Duckett. She's a community activist, a community volunteer, a patient, and interested in health issues from all sorts of perspectives. And we're so happy we're going to have this conversation because it's an important one. So Sophie, tell us why you decided this was a good topic.
Well, glaucoma is a deadly disease, not deadly in terms of dying, but in terms of blindness. And it happens to a lot of people, and it's worldwide. And it can happen without any symptoms. You can get glaucoma instantly. There is no precursor. And I've had friends that have become blind from glaucoma. So I'm very aware of the danger of not being aware that you have glaucoma.
Now, I'm a retina surgeon, and I got interested in it because many of my patients with retinal disease have glaucoma, such as my diabetic patients and my patients who I do surgery, we put a gas bubble. But glaucoma is the leading cause of blindness in America, all ages, from babies onward. And in the world, it's number 2 after cataract, all over the world. And in America, we have 200,000 to 3 million new glaucoma cases a year, which is rising. And we want to sort of bring home the message that there are 2 types, open angle and closed angle. And we want people to feel comfortable about touching their eye and examining themselves. So first, here's the eye. And for glaucoma, what we have is, if you have the cornea on the outside, like the top part of your watch, the watch glass, and the angle is the little area between the cornea and the blue part of your eye, or the brown part of your eye. So if you put the cornea back in, it's this little angle where my finger fits in between the clear part of the eye and the blue part of the eye, the iris, or the brown colored iris in my eyes. So this angle houses something called the trabecular meshwork, this little dot here. So that's the plumbing that goes around the circumference of the eye. Now, as an ophthalmologist, using our fancy equipment, we can't see inside the plumbing. We can just see around it, the angle. We can see the optic nerve, which is this part, which connects to the brain. So if here's the eye, here's the optic nerve, the back, that connects to the brain. So what we found out in glaucoma is that the optic nerve is affected, the blood flow is affected, the trabecular meshwork is affected, and the people visiting an ophthalmologist's office or an optometrist office or eye specialist office, they take their pressure, and then they do a visual field, which tests visual function, whether your eye sees or not. So in open angle glaucoma, which most people have in America, which is painless, progressive visual loss, the visual field shows that you have loss of contrast sensitivity. So that means that if you're walking in a dark parking lot, you can't see the cars at night as well. Or if you're going from a dark tunnel into the light, you can't see. The adjustment takes longer. Or if you're walking in your dark house with the lights off, it takes you longer to see. Like, it takes longer for you to focus to see the darkness. So if you compare your reaction time to your teenage son or daughter, hopefully you'll have the same reaction time in the dark, not so delayed that it is different. If that's the earliest sign of open angle glaucoma, the loss of contrast sensitivity. Some people feel that driving in sunset, they can't see. So it's not only the glare from the sun in sunset, but they truly can't see. Like the leaves on the tree looks like brown, the same color as the sky. Everything looks like brown. There's no contrast. So that's one of the earliest signs. Now, one of the things that I found out, there's angle closure glaucoma, which is the other type. So 2 main categories, open angle and now closed angle. Closed angle is this little narrow space becomes very narrow, and the blue part of the iris, or the brown part, pushes forward because either the lens, the cataract here, pushes it forward. So this little space that houses that plumbing, the trabecular meshwork, is squished. So that's closed angle. Now, certain drugs do this. Cold medications, antidepressants, certain prostate drugs. So it's important that, let's say you've never had any eye exam, but you want to take these drugs, it may be a good idea for you to visit an IMD just to be sure, because you can be having closed angle glaucoma and it'll just happen. The closed angle is one of the true eye emergencies. So you can go blind within 6 hours, it's irreversible, it's lost, it's all over. So some people say, well, doctor, I have 2 eyes, I can lose one. But we don't think this way as ophthalmologists. We want to save both your eyes because we feel both eyes are important. So in angle closure, what you have is painful red eye. So this little trabecular meshwork, this little plumbing is squished, and you feel pain, nausea, headache, vomiting. You almost feel nauseated, vomit, and you have painful visual loss. Everything's fuzzy, and it comes like a crescendo. It'll come and it'll get worse and worse and worse. It's like the worst headache of your life with loss of vision, decreased vision. Then you have 6 hours. So you must go see an IMD or go to any ER. Every emergency room is equipped to handle that by law since 1982 in America. So we thought that I see this, unfortunately, in America and California once every 6 months, which is much too much because we shouldn't see it because we have doctors everywhere. However, California is a very big state, has rural areas. People don't get to where they should be getting. There are nursing homes, geriatric facilities, senior health facilities where people are not able to express themselves and say they have painful visual loss. They just say their eye is red. Nobody's willing to touch them. So we devised something called the glaucoma ball, Glauco ball. We trademarked it. And what we've done is we try to mimic these 3 pressures that are really very important for us as ophthalmologists for you to figure out. So basically, Sophie's going to demonstrate. She's going to take off her glasses. She's going to touch her eyeball like this. So Sophie's touching it. And I, as the ophthalmologist, I'm going to touch her eye. So I'm going to touch her eye like this. And then I'm going to have Sophie touch these balls and figure out which one is closest to her pressure, her eye pressure.
This one is closest to my eye pressure.
So this is the ball that we measured as 10 millimeters of mercury, which children have and also adults can have. This is also 20 millimeters of mercury, which is normal for adults, and this is 40, which is angle closure, which is very abnormal. So if your eye pressure feels like your forehead, unmoving, or like the tabletop, then that's an emergency. That's something, and if you have red eye, painful visual loss, or a loved one is in a senior care center, in a geriatric nursing home, a skilled nursing facility, they can't express themselves, they just say their eye is red, and they just keep touching their eye as if they're in pain. This is something that you would touch your eye, that person's eye, and figure out that this is a medical emergency and they have to see a doctor. And treatment can be instituted immediately because you only have 6 hours. And then the vision will be totally lost, which would be worse for an elderly person with early dementia because once they lose vision, they get more disoriented. So it's even harder to take care of them. And they become more fearful. So it's something that we think is important, especially as eye doctors, eye ophthalmologists. We want to teach our patients this so they're not afraid to touch their eye and feel it. You know, we have the breast self-exam, which really improved early diagnosis of breast cancer. Betty Ford was instrumental in telling people about breast cancer, and she got it out in the open. It was just, in that time, they created the breast self-exam. And you have the skin exam where you just look to see if you have melanoma, and testicular exam for boys, so testicular cancer can be detected. So, Sophie, you had some other questions.
Yes. Tell me, why do you think this is so important, and how, and what does it replace in terms of the instrumentation and the different diagnoses you can have?
Well, you know, in an ophthalmologist's office, we have everything, and most of our equipment are in thousands and thousands of dollars. They have an eye self-exam that's very accurate. It's $3,000. So it's very hard for us to give that to a patient, pay $3,000, you test your eye, especially if you're a chronic glaucoma patient. We want them to take their eye pressure, but there's nothing that's inexpensive. There's one for about $200, but it's inaccurate. So we felt that as an educational tool, this was very simple. It's good for third world nations, for people who have no access. And I showed this to various professors of glaucoma in big cities, and they thought that in their practice it may not be so relevant because there's an ophthalmologist in every street corner in New York City. We understand that. But in California, we have a very large geographic area. We almost take up the entire size of the East Coast. And we have many more rural areas. People can't get to a doctor. This is good. And we want people to feel comfortable in knowing what glaucoma is and how to touch for it, how to feel their eye, feel comfortable. Because otherwise, nobody will just go to an eye doctor every time at a drop of a hat. It takes too much time, driving, distance. But we want people to understand that this is a leading cause of blindness, all ages in America. It's the top 3 leading causes of blindness. And 85% to 65% of people with glaucoma don't take their medications. They don't even bother, you know, or they take it incorrectly. So this will give them an idea, well, how is my eye pressure doing? You know, what happens if I don't take it a week? Does it really go up? Mm-hmm. Or is my doctor just making, you know, a joke and we're just having a good old time and I just take these drops forever? And similarly, hypertension patients, also 85% of them don't take it either. So we have a high number of people, we want to take medicines, but they don't take their medicines. And this is sort of like a self-test to say, look, your eye pressure is going to change if you don't take your medicine. You know, there's a problem. And one of the reasons that open-angle glaucoma takes so long for a person to go blind, it's just very, very slow, painless visual loss. But when it starts happening, then it's rapid. So in that long period where people are partially taking their medicines, I'll take it once a week. I forgot it in my vacation home. I left it in the airplane. They're not going to really see a change. The only change they're going to see if they go to an ophthalmologist's office and we do the visual field testing, fancier testing. But meanwhile, this home educational toolkit, they can really feel some differences. We're going to teach them at the office using this so they can feel comfortable feeling their pressure and to expect this is how their pressure should feel, like the pink ball, like this, because we want our glaucoma patients to be on the lower side. So this is a good way to communicate, you know, for nurses to teach them, for nurses to show other nurses in nursing homes. And it's a leading cause of blindness. As an ophthalmologist, we don't want anybody to go blind ever, and we want to really prevent that.
So how do you treat glaucoma?
Well, if you get it diagnosed in a doctor's office, we usually give eye drops. There are like 4 different types of eye drops. Unfortunately, insurance agencies are now only paying for one type. So if you fail one type, you're kind of having to write many authorization letters to get this other type. But if we get patients more aware of the importance of eye drops and how to test pressure, they also can, you know, demand to have all the types of eye drops available to them. After eye drops are pills, and then laser, and then surgery. But we have a long way to go before surgery, so people don't have to feel, oh, they're so late, the first thing we're going to do is cut on them. And we don't. We just want to tell them. So first thing is awareness.
So who gets glaucoma usually?
Well, you know, it's very interesting. African Americans, when they get glaucoma, it goes really fast, really bad. And Russians, Scandinavians get a different type of open-angle glaucoma. It's called pseudo-exfoliation. So what happens in this lens looks hairy, has little particles falling off of it, and it's clear. And it's a a very different type of glaucoma than Caucasians or African Americans. And Japanese, when they get glaucoma, and East Asians like myself, what happens is that their optic nerve gets really abnormal looking, and they are born with an abnormal optic nerve more than Caucasians. They have a larger opening in the middle. But when they do get glaucoma, we have to tease out the normals with the abnormal looking optic nerve and the abnormal optic nerve with glaucoma in the Japanese and the Chinese population. They also get it fast. The Japanese get it a faster progressive glaucoma faster than the Chinese. It's very fascinating. And also Chinese people get the angle closure glaucoma, as do African Americans, because they don't wear glasses. Certain Chinese don't wear glasses, and they're born with a smaller eye, and they're prone to it. So it's important.
Can glaucoma be prevented?
Marathoners don't get it. They did big studies. If you do upside down yoga and you hang upside down all the time, you push yourself into it. If you drink a lot of coffee, you can raise your pressure artificially. So people who drink 3-5 cups of coffee, and Starbucks counts like as a 2-for-1 special because there's so much caffeine. Starbucks and Peet's.
Okay. What does the pressure rise in the eye? How is glaucoma caused?
You know, this is a very interesting question. Glaucoma specialists like to talk about it for a long time. One of it is that this trabecular meshwork, the plumbing that goes around the circumference, the perimeter of the eye right here, this gets old, falls apart. So it's like your pipes inside your house, instead of remaining the same aperture open lumen, it crumbles. It crumbles. It just doesn't do its thing. It doesn't do its plumbing. And that's from being elderly, having more birthdays. The other reason is they think that the optic nerve blood flow gets changed. People with bypass surgery, after having cardiac procedures, having anything where blood flow is stopped from your aorta to your carotid, so carotid surgery, the blood flow changes, and you hurt your optic nerve. You hurt some of the fibers. So we think those are the two mechanisms. We also think that for some reason we can't suck out the fluid that's made in the eye. We make fluid every 20 minutes. We don't remove that fluid in a prompt manner like we were born, and it becomes deranged. And we think that's the trabecular meshwork, the plumbing.
So once a person gets glaucoma, what is the outlook for that patient?
If they're discovered early, they can have good vision forever. You know, we have very, very good detection techniques, very good eye drops, because we have many types of eye drops now. So they can go on to have a very good prognosis visually. However, as I said, 65 to 85% of the patients do not take their medications correctly or at all. So you have these periods where people don't take their medicines and they do badly. And then that's when the doctors have a hard time getting them back on track. And that's important that they keep their appointments. And I think this self-test is good also, that they have some idea. You know, if you drink a lot, you pass out and you realize, oh, I drank too much. So this is a way for you to have a test at home. Am I